Part of my role within OHID is to make responses to nationally significant infrastructure project consultations, where I liaise with the UK Health Security Agency to provide the health feedback. I always say there's 5 things that local authorities need to consider. The first one is effective targeting and the use of the health impact assessments. So local authorities really need to understand the types of applications that are coming in and what their local public health needs are. What developments would they like to see a health impact assessment done on? They also need to consider what sort of health impact assessment to be used for those as well. So it could be for lower risk plans or policies and developments that they just have a simple checklist, or for more critical ones, then they can have a full health impact assessment. The really important thing for local authorities to remember, this is an end-to-end process. It's not just a question of reviewing the impact assessments. The earlier that local authorities and public health teams can engage with the developer, the better. If you don't scope the impact assessment correctly, you will not get a good, effective assessment at the end of the process. And also that scoping stage allows public health teams to have really early dialogue with the consultants and the developer. The third theme for local authorities to consider is how they're going to actually review or quality assure the impact assessments when they come in, how many staff that they have, and whether any additional training is required for those staff in terms of quality assurance. How are you going to liaise with the planning team should you have any comments or recommendations to put back to the developer and the committee? Once planning permission is given, generally that's not the end of it before, particularly for large schemes. It's quite common for these schemes to come back, which may not necessarily hit the original trigger. And so it can happen that public health teams aren't consulted on what can look like minor variations, but actually could be quite important from a public health aspect. So successfully getting a health impact assessment policy into the local plan is about having a journey. From experience, very often this starts off with 1 or 2 keen individuals in planning and public health coming together, thinking about the benefits of a HIA policy. My advice would be very early to broaden that out to make sure that the wider public health and planning team come on board and then they have the ability to influence that policy development. It's also really important people in the senior leadership team and particularly council members are on board and can have their input in how to that policy then develops during the future. There's nothing better than to look at some current or even historical planning applications and going, okay, would a health impact assessment have been useful in this case? And if you think about the 5 themes that I've discussed and about how to get it right and adopt it as best you can within the local policy, that's going to give you the best chance of success during the examination stage with the planning inspectors. If the local authority have been through that really logical thought process of how and where and why they want to use health impact assessments, that means they have a good evidence base in order to justify their policy if challenged by the planning inspectorate.